Let's get a bit more reaction now to these stories and more. I'm now joined once again with us here, Christina Mnisi, Gauteng Acting Public Health Director. Christina, good to have you, and thank you very much for your time. We spoke to you early in September, where you were coming out issuing a warning to communities, in particularly to heed the call around foodborne illnesses, and the message very clear: improve hygiene practices and ensure that there's a stricter enforcement of food safety protocols in your own home. So a role played by communities, but a role played by individuals. Well, where are we sitting now in terms of those numbers?
Good evening, Thabo, and good evening, viewers at home. Where we are now, we have over 200 cases that have been reported since February to date. Unfortunately, those cases, they also include the 16 deaths. The 16 deaths are mainly children that have been reported. These are the cases that have been reported in our facilities. Remember, a majority of these cases are happening at home, but they're not yet reported.
Right.
So these are the figures that we have at the moment.
Yes, it was 207 in September with 10 fatalities. Now it's 16 fatalities, so a little bit more than 207.
Yes, so the numbers are really going up, and Ekurhuleni has reported a lot of incidences, followed by City of Johannesburg, City of Tshwane, and few incidences from West Rand and also with Sidibeng. So what we have done now with the learners, they have been discharged, and we have seen that there's puzzle shops or the snacks that they bought, that they got from the vendor, they were not labeled, which is very difficult for us to trace. And majority of these snacks, they are being decanted from the big container to small plastics. Yeah. These plastics are not labeled, they don't have expiry date. We cannot even trace the original pack of this snacks. But the learners at the moment, when they went to the health facilities, they have been cleared. When we do the assessment from health facilities, it indicated that it's not really food poisoning or it's not really related to foodborne illnesses. So the learners, all of them have been discharged, they are at home.
COSATU says regular inspection of grocery stores, whether formal or informal, yes, are a priority. But there is a concern that they're raising, one of more and more illegal manufacturing facilities being let off the hook. So the production of these goods is not of sound quality. And they are saying we are not being stern enough in dealing with these cases. What's your view?
As Gauteng Department of Health, we have a Gauteng Food Forum. This food forum consists of Department of Agriculture, Consumer Protection, environmental practitioners, and all other stakeholders, including Home Affairs. Because when all the manufacturers that we have visited, we check if the place is clean, the place does not have any pesticides contamination, what plan do they have in ensuring that they do not have pesticides. So we are monitoring, unfortunately, the illegal ones. If the community can inform us about which ones are illegal or which ones have been, which they are aware of, because we might be aware of certain ones, but there might be others that are outstanding. So we need the community to be our eyes and ears on the ground so that they can assist us as the forum members. When we go there, we'll be able to monitor the quality of goods that are being sold. But the ones where the quality of goods that were not met, we issued them with prohibition notices and also with fines, and most of them have been closed down.
So we were looking at, what, 2,900 in some instances, inspections that would have been conducted, at least in Ekurhuleni or maybe in Tshwane. I forget where that would have been happening. Is there a sense that you are upping those numbers, seeing that there is a rise in reported incidences? Well, they might not be foodborne illnesses, but they come from some kind of food that has been consumed.
With the food forum, we are doing this. The municipality, EHP, environmental practitioners are doing these inspections regularly. And also with the food forum, we are doing these inspections regularly. Yesterday, we were in Naledi, where we were also inspecting this food premises, all food premises. We are not just looking at the spaza shops alone, also the formal ones like ShopRite, Pick and Pay. We are also monitoring them. And at the moment, all the districts have upped the inspection rates. And looking at the number that we are faced with now of the incidents that have been reported, each and every time, each and every second day, every week we've got inspections that are happening. We are getting more stakeholders on board and making sure that all our premises are complying.
Yeah. Greater education remains the approach, but it's a multifaceted approach, as we've already mentioned. The other part of it that COSATU is raising here is a stricter enforcement of food safety regulations, or even those fines that you're talking about being tightened up, maybe even being harsher.
Yes, the fines that have been issued, like yesterday, we were in Naledi, and town planning issued a fine. Environmental health issued a fine. Agriculture also issued a fine. So it was more fines, and also consumer protection also issued a fine to the same individual. So which means, and at the same time, majority of these fines are mainly unhygienic conditions, foodstuffs that are not labeled, and premises that are operating illegally, which means they are not zoned to work to be operating in that particular area. So we have strengthened the fines, the legal matters, just to ensure that people are aware of what is happening on the ground. So it's not just we are doing this once off, but this has been ongoing. But looking at the outbreak, we have tried to strengthen the situation at the moment.
Yeah. So looking at those 3 or 4 departments that were there that issued fines, what does it come up to in terms of a quantum, of a figure?
We cannot really, I cannot really come up with the actual figure, but at the same time, it ranges from the impact. It ranges according to the risk of the fine. So, but we want those people just to consult with the nearest department, and they need to issue those fines. But where we have issued more fines, those premises are closed.
Yeah.
Just to make sure that the person does not really operate in that particular area until the person complies, or until the person brings the legal documents that are needed for him to operate in that particular area. But maybe just before we issue the fine, we are also providing health education and awareness to say these are the elements that you need to look into instead of just giving a person a fine, so that the person is educated first and knows exactly what is the impact of the fine, and also the importance of the education that has been given. For example, we saw some dented tins that were also on shelf, some expired products that were on shelf, and those products were collected and were going to be disposed of. They were sent yesterday for the waste disposal.
Yeah. So, I mean, communities look at that and they say the problem might not even be at the level of spaza shops that you are raiding with dented tins and so on and so forth. The biggest issue would have been at them coming into the country into the first place, those products.
Yes, we are having border management who is also monitoring the incoming of products in the country. So as we go to these areas, we also saw some products which are labeled in Chinese, which the consumer does not even know the active ingredients that are there. But those ones are being handled by border management, and we are also working with them. Whatever that we find non-compliance, we are removing it from the shelf.
Yeah. Is there a plan? Is there a sense that there is a plan and conversations that are happening around lawmakers around that particular issue of stricter enforcement of regulations that govern what comes into the country? Because people are going to continue to blame, of course, foreign nationals, saying they are bringing these products. But they don't just bring these products from the sky. They use the roads, they use the ports, they use the port of entry to bring these things into the country. And we have government officials that are given the responsibility to ensure that what comes in is of good quality.
We have a border management authority that ensures that all the products that come through our points of entry are being monitored.
Yeah. How do they come in then?
Most of them is illegal.
How exactly?
Most of them is illegal.
Where are the gaps? We're supposed to then find those gaps. Is that not what we should be focusing on? Yes, we'll do the education, educate the people. But where are these gaps, and why are we not filling those gaps?
That is why the ones that came illegally, that's why we are doing this food inspection in all premises, just to monitor if there are any other illegal products that are within the country. Because border management is going to monitor at the point of entry. Yeah. But already there might be others that have linked somewhere somehow. Then we are coming back to those ones. That's why we are doing these inspections, to monitor each and every product that is being sold in any formal food premises, and also in our spaza shops, to ensure that we remove those ones and make sure that the products that are being sold are safe for human consumption.
Yeah. Generally, in the ones that we have been dealing with, the Naledi story, for example, unfortunately, all 6 came to their demise. These are children. The 74 learners are happening in 3 of the Gauteng schools. Others, of course, not in your purview, but they're in Limpopo, 20. There are others in Mpumalanga as well. But all of them seemingly are either around school children or are happening at the schools themselves. What needs to be the focus? Where's the gap there?
Currently, we have the school department that we are working with. They are also part of our outbreak response teams. So we've got a collaboration with them. We are training the food vendors inside the school premises. They even have SOPs to say, in case, standard operating procedure, in case there is a child that is not feeling well, how to report to the nearest facility. So there are activities in such a way that we have visited several schools where we went to their assembly and provide health education, because we have seen that it's not just the products that are being sold, but there must be there is an element of a secondary contamination, which means a person can buy a product from the shop that is safe, but there might be a secondary contamination during preparation at home, or maybe during the preparation or handling during that process. So there might be an element of contamination. So the issue of hand washing is very, very crucial. So we are also inspecting those areas just to ensure that they comply with environmental standards.
So a report of 45 all falling ill at the same time, you think that could be consistent with secondary contamination?
It differs. There is an element of secondary contamination, but majority of them we go back and monitor. For example, the Western case where so many kids were, the ones that were in a matric camp, we also went back because they were in a school camp within the same premise. We went to those food handlers. We were able to do the inspection and investigate thorough, and we found that there might be secondary contamination from the food handlers. So, but at the meantime, we go back and do health education and awareness.
Yeah, and what happens in that particular instance where the ones who were preparing the foods would have not followed the proper hygienic methods?
We educate them on the precautions that they need to follow, and we also report them to the school principals, because as they are sitting there, they are under the school principal eyes. So they are there to make sure that those people, they comply. And whoever that is preparing food in school premises, they must make sure that they've got a certificate of acceptability. And now and then, this is not just a once-off monitoring. We are monitoring them very closely. And we want the Department of Education to work with us for all these camps. So aware that Matric is starting their exams very shortly. So we want to work with them and monitor those school camps. And the ones that they are planning in future, we should be involved as a Department of Health.
Acting Director, Public Health and Food Safety in the Department of Health in Gauteng, Christina Mnisi, as always, much appreciated. Thank you very much for coming in tonight. In Focus continues shortly.